Hello, everyone. My name is Nadine Fregoso, and for this medical terminology final, I decided to choose the skeletal system. The skeletal system is the framework of the human body and the way we are structured. Without the skeletal system, we wouldn't be able to hold our organs in place and we wouldn't be able to hold our cartilage and ligaments together. This also includes protection in the body. In an adult body, we have about 206 bones, and our skeletal system is divided into two parts. The first part is the axial skeleton. The axial skeleton are the bones in the center core of your body. This includes your cranial, your neck, back, and rib cage. This is important because it holds your most important organs together, such as your heart and your lungs. Another important thing to realize is that it holds protection, especially in the brain, which is crucial to one's life. So in the axial system, we could see here that it starts from the cranial and goes down and even includes the sacrum area. So the second part is the appendicular skeleton. The appendicular skeleton consists of the major bone groups in the body that forms the limbs. So this includes your shoulders, forearms, arms, legs, and even the supporting structure bones like your pelvis. This part of the skeletal system is essential for us to do our daily tasks and activities and be able to move freely. So in the appendicular system, we could see that it includes more bones and it starts at the clavicle area and even goes to our humerus, all the way down to our phalanges in the toes. So let's talk about injuries and diseases. So there are many injuries that occur with bones. While bone fractures come in all kinds of sizes and levels, we must also think about how the skeletal system actually works with our muscles and ligaments as well. Muscles will pull the bones, and by using our tendons, this will allow us to have our movement. Two common diseases people can get with the skeletal system is rheumatoid arthritis and osteoporosis. We can see that arthritis ends in itis, in which this suffix means inflammation. Arthritis happens when there is stiffness and inflammation in our joints. Arthritis comes from the Greek word with arthron and itis formed together. Arthron means joint and itis means inflammation, hence arthritis. This can start at any age, but is most common after the age of 40. While there is no cure for arthritis, the main thing you can do is treatment, such as medication and physical therapy. Physical therapy will help relieve some joint pain, so it makes it easier for us to do our everyday tasks before it starts to hurt again. This disease does tend to get worse with age and can limit your mobility to do things such as bathing, walking, and typing. Now, with osteoporosis, osteoporosis is a medical disease that causes your bones to become weak and very brittle. This increases the risk of getting injured easily and getting fractures. Osteoporosis has a suffix of osis, and the meaning of this is the disease or condition of. This word tracks down to the Greek roots in which osteo relates to bones, poro translates to weak in English slang, and osis means disease. Putting these together creates osteoporosis. Typically, a healthy body is constantly absorbing and replacing old bone tissue. So with osteoporosis, your body can't keep up with replacing old bone tissue, and it causes your bones to become very brittle. There are many factors as to why we can get this, especially with age. This has a lot to do with not taking in enough calcium and vitamin D when you were getting to of age. Calcium is essential for keeping your bones strong and healthy. This disease is more common in women and does get worse with age. You can try to prevent your body from getting osteoporosis, if you include weight-bearing exercises, calcium, and vitamin D. But once you have it, the best treatments you can get are medications to prevent bone loss and fractures. We must be aware that with this disease, we can easily hurt ourselves or we are at risk for fall. So overall, the skeletal system is one of the most important systems to have in our body. It's important to be aware of this system because there are a lot of injuries that happen all the time, like fractures and dislocations. The importance of medical terminology in general is essential for when you want to work in the healthcare system or anything that has to do with the human body. Medical terminology helps us prevent errors when diagnosing and treating patients. There are specific terms that you must know in order to understand the injury or the disease. So I chose to take medical terminology because I am a nursing major and it's important for me to understand as many medical terms as possible, such as the prefixes and suffixes. After taking this course, I'm able to look at certain diseases and think, oh, this ends in itis. So it has to do with inflammation. Or if we look at fibromyalgia, it ends in algia, so it means pain and discomfort. This course is important to take for any kind of medical specialties, and this class is a great advantage and will help us ensure that we will be doing our jobs as well as possible with us knowing a lot of these medical terms. So, thank you.